Hi friends, in this video today I will talk about ambulatory blood pressure monitoring. First is a disclaimer. Ambulatory blood pressure monitoring is currently the best method to diagnose high blood pressure, that is hypertension. The ambulatory blood pressure monitoring devices are automatic programmable machines that measures the blood pressure using the oscillometric method. Like other similar devices, they need regular maintenance and calibration to stay accurate. In a 24-hour ambulatory blood pressure monitor test, blood pressure is measured at regular interval, ideally every 15 to 30 minutes, resulting in about 48 to 96 readings in total, and this includes at least 20 readings during the daytime and 7 readings at night. After 24 hours, the device calculates average blood pressure values such as daytime average BP, nighttime average BP, and overall 24-hour average blood pressure. It also gives information on patterns like dipping, that is normal drop in blood pressure during the sleep. According to the 2018 European Society of Cardiology guidelines, the ambulatory blood pressure monitoring is considered valid if it records at least 70% of the planned readings. For references, an official or office BP of 140 to 140 by 90 equals about 135 by 85 mm of mercury during the daytime on ambulatory blood pressure monitor, or 120 by 70 mm at night, and 130 by 80 mm over 24 hours. The diagnostic value of ambulatory blood pressure monitoring, it helps doctors to get a more accurate picture of the patient's blood pressure by recording it through the day and night, capturing the natural, or we can say diurnal, changes in blood pressure. Many large and long-term studies have shown that ambulatory blood pressure predicts future health risks better than the other methods like home or clinic blood pressure measurements. For example, in Osama study, it was found that ambulatory blood pressure monitor can predict the risk of heart-related deaths even after adjusting for other risk factors, including the home blood pressure. Data from international database on ambulatory blood pressure also supports a strong diagnostic and prognostic value of ambulatory blood pressure monitor. The ambulatory blood pressure monitoring and cardiovascular outcomes. A study was conducted involving 7,030 people from Denmark, Belgium, Japan, Sweden, showing that the daytime systolic blood pressure measured by the ambulatory blood pressure has a stronger ability to predict the future heart and blood vessels problems than the blood pressure measured in a doctor's office. How do we diagnose the hypertension or high blood pressure using the ambulatory blood pressure monitoring? Hypertension is diagnosed when the ambulatory blood pressure monitor shows 24-hour average BP of more than equal to 130 by 80 mm of mercury. This is called sustained hypertension. If daytime average BP is more than 135 by 85 mm of mercury, it is called daytime hypertension. And nighttime average BP of more than 120 by 70 mm of mercury suggests nocturnal hypertension, and morning average BP of more than equal to 135 by 85 suggests the morning hypertension. A white coat versus masked hypertension. The white coat hypertension is diagnosed when the clinic blood pressure is more than equal to 140 by 90 mm of mercury, but the ambulatory blood pressure shows that the 24-hour BP is less than 130 by 80 mm mercury, daytime BP is less than 135 by 85, nighttime BP is less than 120 by 70, and morning BP is less than 135 by 85. Means your clinic BP is more, but the ambulatory blood pressure monitor shows all the readings of 24-hour BP, daytime BP, nighttime BP, and morning BP less than the normal predicted value. The masked hypertension is diagnosed when the clinic BP is less than 140 by 90, but the ambulatory BP shows 1 or more of the following, that is 24-hour BP is more than 130 by 80, daytime BP is more than equal to 135 by 85. This is called masked daytime hypertension. Or if the nighttime BP is more than equal to 120 by 70, it is called masked nocturnal hypertension. And the one morning blood pressure is more than equal to 135 by 85, we call it as masked morning hypertension. This is the hypertension classification based on office and ambulatory blood pressure monitor. This I have taken from the medicine update. When should we use ambulatory blood pressure monitor? The latest guidelines, they recommend that ambulatory blood pressure monitor or monitoring should be used to detect the white coat hypertension, to detect the masked hypertension. It is also useful for people who have variable 24-hour BP readings at home or in clinic, the patients who have target organ damage, patients with suspected secondary hypertension, patients with drug resistant hypertension, when we want to monitor the response to BP medications, patients with autonomic neuropathy, or patients who presents with orthostatic hypotension. Few studies were conducted. For example, for white coat hypertension, 4 clinical studies from the Italy, US, Japan, they followed about 4,406 patients for about 5 years. They found that people with white coat hypertension had about 1.15 times higher risk of stroke, and people with high BP on ambulatory blood pressure monitor they had 2 times higher risk of stroke. Both were compared to those with normal BP, and thus the guidelines suggested that white coat hypertension should be carefully evaluated, especially in the people with other health problems or target organ damage, to decide the best treatment. So far, no randomized control trials has compared giving BP medications versus no treatment in white coat hypertension patients without other diseases. Coming to the masked hypertension means BP is normal in the clinic, that is, it is less than 140 by 90 mm of mercury, but high at home or during the daily life. Certain factors which increases the BP outside the clinic, they include alcohol use, physical activity, diabetes, high blood, high body weight, that is BMI, high BMI, stress, smoking, and the researchers have shown that the organ damage in masked hypertension is similar to regular hypertension, even though their clinic BP readings are different. In fact, people with masked hypertension, they had 2 to 3 times higher risk of major heart problems compared to those with normal blood pressure. The long-term health outcomes are also similar to those with both high clinic and home BP. Coming to day-night blood pressure changes and early morning BP rise, the blood pressure naturally changes throughout the day. As we know it, it is higher when we are awake and drops to its lowest level during the sleep. Ambulatory blood pressure monitoring is the best way to track these daily changes. If the BP drops by more than 10% at night, the person is called dipper. If the nighttime drop is less than 10%, we call it as a non-dipper. I have already discussed in my previous video. If the BP is higher at night than during the day, we call it as a reverse dipping, which is linked to higher risk of heart disease. Studies like PIUMA studies have shown that non-dipping patterns are associated with organ damage like damage to the heart or the kidneys, and they have worse outcome in hypertension. So dipping status help us to assess the cardiovascular risk more accurately. The early morning blood pressure surge. It has been seen that heart attacks, strokes, Sudden cardiac deaths often happen in the early morning, while the studies looked at whether a sharp BP rise in the morning predicts these events. Major studies like PIUMA and Pamela did not find it to be an independent risk factor. Coming to the blood pressure variability, it refers to how much BP fluctuates during the day. It is usually measured by a standard deviation of BP values in 24 hours. Other ways to measure the blood pressure variability are weighted standard deviation, variability independent of the mean, maximum minimum difference, variability ratio. Higher blood pressure variability is linked to the high organ damage and high risk of stroke and death. The pulse pressure is the difference between the systolic and the diastolic blood pressure. Higher pulse pressure has been associated with carotid artery disease, heart muscle thickening, brain white matter changes. So the ambulatory pulse pressure is a better predictor of heart related illness and death than the office pulse pressure, even when adjusting for other risk factors. Ambulatory blood pressure monitoring in hypertension treatment. In Asians population, the strict BP controlled by ambulatory blood pressure monitor showed better outcome, especially in the stroke and the heart failure patient, as compared to other population. The ambulatory blood pressure monitoring helped achieve the target blood pressure in about 26% of the primary care patient when used to guide the therapy. In low risk patients, ambulatory blood pressure monitoring can be done once a year along with the home blood pressure monitoring. In high risk patient, it may be repeated every week, every few weeks to months. So the ambulatory blood pressure monitoring is also useful in resistant hypertension to tell if the resistance is real or due to the white coat effect, and thus it helps the doctors to choose the right treatment. In pregnancy, especially in the third trimester, the ambulatory blood pressure monitoring showed that women with high BP they are more likely to need a cesarean section. It can help predicting the preeclampsia and growth problems in the baby, especially the IUGR. Ambulatory blood pressure monitoring is not the current part of the official guidelines for managing these conditions, but it helps in identifying the white coat hypertension, avoiding the unnecessary medications. The American College of Cardiology and the American Heart Association has now emphasized that the use of healthcare technologies in managing the blood pressure. A web-based ambulatory blood pressure monitoring platforms allows data to be recorded and analyzed remotely by the physician. This can help detect early heart problems and improve the prevention. This proactive approach is a part of what is called anticipation medicine, aiming to prevent the heart disease before they occur. The clinical application of the ambulatory blood pressure monitoring, according to the American and the European hypertension guidelines, the ambulatory blood pressure monitoring is recommended for all patients being considered for blood pressure lowering treatment, especially to confirm the white coat hypertension, that is the high BP only in the clinic. Masked hypertension means normal BP in the clinic but at high at home. If the patient needs multiple treatment adjustment, the ambulatory blood pressure monitoring may be repeated. Home BP monitoring or automated BP readings in the clinics are also useful alternatives. Ambulatory blood pressure monitor over 24 hours is helpful when increasing the medication dose as it shows BP during the night time and daily activities, especially while standing or moving. In patients with white coat hypertension, some BP readings can support the ambulatory blood pressure monitoring results. However, the clinic BP measurements remain the first step for screening the hypertension. Both home and ambulatory blood pressure monitoring are valuable, especially in the long term follow up. If clinic BP is high but there is no organ damage, or if there is unexplained organ damage, the ambulatory blood pressure monitor and the home monitoring BP should be considered. When telemonitoring is used with home BP monitoring, it becomes an even stronger tool by helping to educate and engage patient in their treatment. This is the diagnostic workflow for evaluation of patient by use of home, office and the ambulatory monitoring of the blood pressure. If we suspect white coat hypertension, that is isolated clinical hypertension, patient had a persistent raised clinical blood pressure, and if there is we have to see whether the patient has a target organ damage or not. If target organ damage is there, we have to start the treatment. If there is persistently raised clinic blood pressure with no target organ damage, then we ask the patient to follow the uh, home BP monitoring, and if it is low, then we go for 24-hour ambulatory blood pressure monitoring. If it is still low, then we continue to clinic and home BP monitoring measurements. But if 24-hour ambulatory blood pressure is high or home BP is also high, then we have to start the treatment. Similarly, in cases of masked hypertension, means the patient has isolated ambulatory hypertension, they have normal BP in the clinic, we have to see the target organ damage. If target organ damage is questionable, we do 24-hour ambulatory blood pressure monitoring. If it is high, we have to start the treatment. And we have to continue to monitor the clinic and the ambulatory blood pressure monitoring in such cases. To conclude, ambulatory blood pressure monitoring has become an essential part of the modern hypertensive care. It is the only tool that can measure the BP around the clock, including the BP variability, nighttime hypertension. Both these are major risk factors for organ damage and heart complication. Ambulatory blood pressure monitoring also helps to adjust the medication timing and dosage by giving insight into 24-hour BP patterns. In Asian population, the ambulatory blood pressure monitor is especially useful because BP tends to be very more BP tends to vary more throughout the day. Nighttime hypertension is more common, medication adherence is often lower. Using the ambulatory blood pressure monitoring in everyday clinical practice can lead to fewer heart complications and better outcomes for the patients with high blood pressure. These are my references. I will suggest the reading from these literature or the journals. Albert Einstein has said, only a life lived for others is a life worthwhile. With this, I conclude my today's topic. Thank you. Keep learning.